people than I thought that on Friday, summer afternoon on Friday. I thought that there's going to be just maybe Maria and Isara and me, but there's a good to see so many of you.
Yeah, almost 50. Yes.
All right, excellent. Thank you for the introduction, and I think that I'm just gonna and thank you first of all. Also, thank you for the opportunity to talk about the topic that has been close to my heart for a long time, and focus of the research that I've been involved for quite a while already. So that said, for the next during the next 30 minutes, my intention is first to give you a quick introduction to dry cow therapy by looking at the history and goals of DCT. So I'm going to be using this abbreviation DCT, and then we'll look at the approaches to DCT. And then I'll share some of the Finnish experiences and results from our Finnish dry-off study. And I need to also say a few words about the milk sampling practices in Finland. And then at the end, I will share with you some data on milk quality from Finland, which will hopefully see that the targeted use of antibiotics actually works. That said, when the very early studies of dry cow therapy were conducted, the prevalence of contagious mastitis was really high at the time. And that was primarily caused by Staph aureus and Streptococcus agalacti. And when the studies were done and antibiotic penicillin given intramammarily into the cows at the final milking of at the end of lactation, curing, and the results showed that the cure and prevention of intramammary infections was very high. So DCT was very effective on that for considering infections caused by gram-positive pathogens. And based on those very promising results and the high prevalence of contagious mastitis at that point, the recommendation was made that it's best to treat all cows at dry-off with DCT. And indeed, this recommendation became part of the so-called 5-point plan for mastitis control that was developed in the 1960s. It was my phone doing some weird squeaking. Sorry about that. So when we look at dry cow therapy, why we are using dry cow therapy, it has two goals. One is to eliminate existing subclinical intramammary infections, because we don't recommend treating subclinical mastitis during the lactation. And then the other part of the goal for dry cow therapy is also to prevent new infections from occurring during the dry period. And so it's a twofold, can be used for two ways, for both for therapeutic and prophylactic method or with a target. And ever since those first DCT studies, dry cow therapy has actually been a crucial part of mastitis control, but the approach differs quite a bit between countries. And this is what I was exposed first when I was in the US. And the one approach is blanket dry cow therapy, where all quarters of all cows are treated with antimicrobials, regardless whether they are infected or not. Everything is routinely treated. And the other approach for dry cow therapy is selective DCT, where only cows or potentially only mammary quarters that are presumed to be infected are treated. So with blanket treatment, blanket DCT, the goal is there's clearly both therapeutic and prophylactic use of antibiotics, whereas a selective dry cow therapy is mostly therapeutic. The blanket DCT has been adopted really broadly worldwide. However, in the recent decades, the concerns about development of antimicrobial resistance and consequently new legislation have forced a switch from blanket to selective dry cow therapy in many countries. And in the countries where blanket dry cow therapy has been used, and this is what I was exposed to and learned about when I was in the US, the very widely held belief and also very strongly held belief has been or still probably is that switching from blanket to selective dry cow therapy would be detrimental to udder health, and therefore it would not be economically justified. Also, the other argument against selective dry cow therapy in countries using blanket dry cow therapy has been that it is very challenging to accurately and cost-effectively identify the cows that would need the DCT, and also those that could be left without it. And that certainly holds true. But the antimicrobial resistance and concerns about it have kind of changed the mindset. And indeed, if we look at the number of publications which have selective dry cow therapy in the title or abstract, we can see that during maybe the 15 or 10 years past the last 10 years, there's been a huge increase on the number of publications dealing with this topic. So there's clearly a paradigm shift is occurring on this issue. So with that quick background, we'll jump into the experiences from Finland and other Nordic countries. The Nordic countries have always followed prudent antibiotic use guidelines, and this includes also treating cows selectively at dry-off. So we use the antibiotics therapeutically, and only the cows that are presumed to be infected receive antibiotic DCT. When I was in the US, this was kind of obvious to me that this is what we do. But when I moved back, I realized that we really don't have any hard data and numbers on this. So the hard data on drying off practices in Finland was not there, and therefore we initiated a study looking at this on this topic. And we started our dry cow project with an online questionnaire to Finnish dairy farms that were part of the DHI, Dairy Herd Improvement Association, or the Milk Recording Registry. And we did that on 2017. And the goals with this questionnaire was first to survey the drying off practices in general and to estimate the use of antimicrobial DCT in Finland. And we got over 700 farmers responding to this questionnaire, and this is what the data looked like. And it was what we actually had anticipated and kind of knew it already, that majority of the farms in Finland, which was based on this questionnaire, 78% of them use selective dry cow therapy. 9% of the farms responding to this questionnaire said that they don't use any antibiotics at all at dry-off, and 13% said that they gave antibiotics to all cows. When we looked at in the selective dry cow therapy farms, the responders reported that test day somatic cell count and mastitis history of the cow were used as the criteria to decide which cows should be treated and which can be left without it. And in addition to these two criteria, also almost 90% of the respondents said that they tested milk sample microbiologically, at least from some cows, before dry-off and before giving any antibiotics. And what was quite surprising to me is that even in the blanket DCT herds, almost 2/3 of the farmers reported that they test milk bacteriologically, at least from some cows before the treatment, even though they were planning on giving the treatment to the cows anyway. And from those farms that responded to the questionnaire, we also got a permission to use their DHI data to look at different, so for example, association between the herd DCT approach and the herd average somatic cell counts and milk yield. And this one was part of Riitta Nieme's PhD work that she did. So a lot of the credit for all the analyses go to Riitta. But anyway, these graphs on the left shows the herd average somatic cell count. We had the herd level data from 2012 to 2016. The questionnaire was done in 2017, and the y-axis here shows the herd average somatic cell counts on this picture, and you can see that between these different groups, no DCT, selective DCT, or blanket DCT, the pattern is very similar, and there's as well as when we look at the herd average milk yield, also the pattern on these different groups is very, very similar. And indeed, based on this DHI data, we did not see any differences in the herd level somatic cell counts or milk yield between herds that were using either blanket, selective, or no DCT at all. We had also cow level data from 2016, from the last year on that we got the DHI data, and we looked at more carefully on the cow level information, and on average 21% of the cows were treated with DCT, and what we observed from this data is that the treated cows in the DCT herds, they did have a lower somatic cell count at calving than the untreated cows, and if a high somatic cell count cow had missed getting DCT at dry off, that was negatively associated with a subsequent lactation, somatic cell count, and the milk yield. And the higher the milk yield was, higher the somatic cell count was at dry off, the bigger the difference was between the treated and the non-treated cows. So, in addition to the retrospective study based on the DHI data, we also did a clinical field trial during this project, and with that one, the objectives were to evaluate the intramammary infection cure rate, new intramammary infection rate, and the post-calving intramammary risk among cows that receive and do not receive DCT. And we enrolled 12 automatic milking system herds into this, and all of these herds were using selective dry cow therapy. And just very, very briefly, based on the last test day somatic cell count, we divided the cows into 3 groups, and the main interest was in cows that had somatic cell count between 100 and 250,000 cells per mil at that time. And these cows were assigned to either receive antibiotics or not receive antibiotics at dry off based on the ear tag number. And this was one done, and all the cows that had somatic cell counts above 250,000 cells were actually treated with dry cow therapy. And this was one that was done on the farms, and the farmers also collected quarter milk samples for us from these cows before dry off and after calving, and they were all PCR tested to see if there were any pathogens to be found. And some results from this field trial and observations from this field trial was that the cure risk was actually quite high in all these groups. Even in the non-treated group, the spontaneous cure rate was over 80%. However, what we noticed also is that the untreated quarters were more likely to acquire new intramammary infections during the dry period than the cows that had been treated with antibiotics. And I have to say that in this study, we did not use any teat sealants during the study. And the non-oral staphylococci or coagulase negative staphs, CNS or NAS, however you want to call them, were the most common cause of intramammary infections, both at dry off and after calving. So that was that, and but then we did ask something also about the general drying off practices in the questionnaire, and it came pretty clear from that that gradual dry off is widely implemented in Finland. That was what we actually anticipated also. Almost all farms, 96% of farms, said that they reduce milking frequency before the final milking at the end of lactation, and also almost 90% of the farms changed the ration to restrict the energy intake of the cows, and this one was aiming at reducing the milk yield before the final milking. And indeed, that is quite a rational way of doing it, because it's been shown in several studies that high milk yield at dry off is associated with increased risk of intramammary infections after the dry off and during the dry period. And that actually shows that there are several benefits to the gradual dry off. With doing the drying off gradually, it brings the milk yield down and accelerates the involution and brings the natural corrective factors in milk up already before the final milking. And we get the milk yield down, and that leads to the fact that there are fewer open teat canals and less milk leakage because there's not so much pressure in the udder, and all that results in fewer infections after dry off and at calving. And it also improves the cow comfort because there's less pressure in the udder due to the accumulating milk. So it's there's not that much discomfort to the cow. So the current drying off recommendations that we have in Finland, partially based on our own study that we did, and also based on general information from other studies, is that we do recommend the gradual dry off so that the milk yield level at the final milking at the end of lactation would be below 15 kilograms before the cow is totally stopped being milked. And we do recommend the use of DCT for cows with subclinical mastitis, and these cows would be such that if the somatic cell count is repeatedly above 200,000 cells per mil during lactation, or it's above 200,000 at the end of the lactation before the actual drying off procedure has started. And also, if the cow is treated with clinical mastitis during lactation, and especially if she still has elevated SCC at the end of lactation, that warrants giving her antibiotic dry cow therapy. And based on the fact that we noticed that there are a lot of new intramammary infections, or more new, the risk of new intramammary infections is higher in the cows that did not get antibiotics at dry off. We also recommend considering using internal teat sealants for prevention of these new infections. However, this one we need to keep in mind that a good hygiene and aseptic application method is crucial when putting in these internal teat sealants, so that we are not putting any bacteria, applying any bacteria with the teat sealants into the udder. So then a few words about the mastitis diagnostics in Finland. We do a lot of milk sampling, and I would say that the bacteriologic diagnosis before initiation of any antibiotic treatment for mastitis is pretty much a routine procedure in Finland. And PCR or polymerase chain reaction methodology is currently the main method that it's used for mastitis diagnostics, and it's been like that since 2010. And that's when the biggest dairy processor or pharma cooperative in Finland switched in their mastitis lab. They switched from bacterial culture to PCR. And the commercial PCR assays that are on market in Finland at the moment, they identify 15 most common mastitis pathogens, as well as a BLA-Z gene, which encodes the beta-lactamase production in staphylococci. So it tells us whether the staphylococci that we find in the milk samples are actually can be expected to be susceptible for penicillin. And we do often get asked that how have you been able to get all your producers to take so much milk sampling? And I think that just like in the US, when I was talking with the colleagues and farmers there, they said that, well, you have to treat all cows at dry off with antibiotics because that's how they have been trained for it. Both veterinarians and farmers have been trained for decades that that's what you need to do. Similarly, our veterinarians and farmers are trained to base the treatments on bacteriologic diagnosis, and that's what's happening. And there is also the mindset that when you take the milk sample, that maybe the results will tell you that you don't actually need to treat. So you save the money from the treatments, and you also save the money for not needing to pour down discard the antibiotic milk after the treatment. And also one big deal what makes this sampling working is the very well functioning logistic with PCR. The farmers can take the milk sample and send them via the milk truck to the lab, they can be sent also through the post office. And with PCR, we have a very quick turnaround, so very often the next day they already have the results in their hands. And now then some hard data on the mastitis treatments and sales of intramammary tubes in Finland. This is from the Finnish Food Authority publication from last year. And this one shows, first of all, here is the green line on the top is the number of dairy cows in Finland, and it shows a slight decrease on the number of cows. But then these pink bars here, they are the number of dry cow tubes per cow that has been used or have been sold in Finland. Tubes per cow, and you can see the dry cow tubes. It's a little bit less than 1 tube per cow, so it actually coincides very, very well with the data from our health recording system that says that approximately 20 to 25% of cows are treated due to mastitis annually, and this percentage actually includes the dry cow therapy. So it's a little bit less than one tube per cow that has been used during this last 10-year period from 2015 to 2024. And this graph also shows the blue bars here are the sale of lactational intramammary tubes, and that has actually dropped about 45% with this 10-year period. And in Finland, penicillin is the most used drug in mastitis treatments. We practically don't have much else. We have cloxacillin tubes as well, but penicillin is definitely the drug of choice in Finland. And then some hard data on the milk quality in Finland. The milk is classified into 3 quality classes, and the highest quality class, so-called class E, requires that the somatic cell count in the milk based on a 3-month rolling average is less than 250,000 cells. And this graph on the right here shows it's collected by the Finnish Milk Hygiene Association that gets information about each milk load that goes into processing, and they analyze that. And this shows that since 1998, over 90% of the milk that is shipped for processing in Finland has been in the highest quality class. And since 2014, over 95% of the milk that is being processed in Finland has been in the highest quality class. And while that says that it's below 250,000, this graph actually shows that in reality it's way lower than the 250,000. This is also data from the Finnish Milk Hygiene Association, and it shows data from 2018 to 2023 and through the different months of January all the way to December. And you can see that on average, on the national level, the milk somatic cell count is hovering around the 130,000. There's a little bit of a peak on the somatic cell counts during the summer months, which is quite common, I would say. And also in 2023, over 97% of the milk belonged to the highest quality class, and indeed it was actually much lower than that 250,000. So it was at 136,000 cells per mil. So with that data, I would say that the targeted use of antibiotics definitely allows us and is adequate for producing high quality milk. And indeed, when we look at the studies that have been done worldwide, we can see there's a lot of studies that have shown that selective dry cow therapy can maintain a good udder health as well as high milk production level. And also, studies have shown that economics is not an argument or cannot be used as an argument against selective dry cow therapy. With selective dry gout therapy, we are actually taking away that prophylactic effect of antibiotics. So internal feed sealants have been studied quite much as well, and they've been shown to be effective in preventing new intramammary infections, whether they are used with or without antibiotics at dry off. So when we are looking at antimicrobial stewardship, we can say that switching from blanket to selective dry gout therapy can actually significantly reduce antimicrobial drug usage in dairy herds. And there are different estimates from different studies based on what the level of infections at the herd is and whether the selective dry gout therapy has been done on quarter level or cow level and so on. But these different studies have reported that by switching from blanket to selective dry gout therapy, the reduction in antimicrobial usage can be anywhere from 20 to over 80%. So I think that it's time to wrap up pretty quick here. So some future perspectives and thoughts to close up is that I'm sure that dry gout therapy will continue to be an important tool in mastitis control, but its use needs to be more targeted than it has been. And the question still remains to some degree that what is the best way to identify the cows and quarters for treatment, or to identify the cows that don't need the treatment. And as there are a lot of differences between farms and herds, the advice to the farmers on dry gout therapy should be herd and cow specific, and even maybe pathogen specific. And this would require bacteriologic diagnosis of the causal agents of IMIs, or if not, all cases would be probably nowhere. All cases will be sampled and milk samples tested. But at least we should have a knowledge of the herd pathogen profile in order to be able to give effective advice. And with selective dry gout therapy, we are able to reduce the antimicrobial usage in dairy herds with relation to mastitis control. And then it remains to be seen how far this selective treatment will go, and will we actually go into quarter level administration of the dry gout use. And given the fact that mastitis is a multifactorial disease, which this epidemiologic triangle here is depicting, that there's the characteristics of the agent as or the mastitis pathogens, the host or the cow, and the environment, the barn environment where the cows and the pathogens are. We need to take a holistic look and consider the overall management of dairy cows, not just the antibiotic dry gout therapy. And also drying off procedures may help in mastitis control in this, and gradual dry off may bring many benefits on controlling mastitis as well. Which is, I know that abrupt cessation of milking is very, very common in most countries, but I strongly believe that gradual dry off has its benefits. And with this one, there are some of the references from the Finnish studies, and with that one, I thank you all for your attention, and thank you for being here on Friday afternoon on summer week, and especially holiday season. And if there are any questions, I would be happy to entertain them and try to answer them to the best of my abilities. Thank you very much.
Thank you so much, Päivi. Yeah, there is time and room for questions, and I hope everyone that has a question can introduce yourself, like from which country you are and from which institution. Are there questions? I see Sinske Lipkens.
Hi, thank you for the presentation. My name is Sinke from Milk Control Center of Belgium, veterinarian, also working a lot with selective dry gout therapy. A question about the milk production and reducing the frequency. how do you have some practical guidelines how to do it to get below the 15? Is it starting a week before, a little bit longer, only 3 days? Those questions are quite common in my experience.
Yeah, and we are actually currently we have taken up the Swedish recommendation on their drying off procedure, where you start reducing first. You get a 36-hour. You skip a couple of milkings, and then after that you skip 1 day completely of milking, and do it so many times that you get the milk yield to the below 15. So gradual dry off.
So you do go to the 15. That's the starting point of drying off.
Yeah, that's currently the recommendation, and in fact, I have to say that the Finnish farmers actually go often even below that. In my mind, maybe unnecessarily, but they can, based on that field study that we did, we could see that it was sometimes the final day of milking, the milk yield was already below 10 kilograms. So maybe even too low, but anyway, the 15 is kind of the target.
Yes, it's quite nice not to have a separate group or a close off or a far off. It's doable for every farmer then.
Mm-hmm. Yeah, and it actually works with the automatic milking system, where you can start reducing the milking frequency automatically, and they usually do it maybe over a couple of weeks even, that they start reducing the milking the number of milkings that are allowed for the cows.
Thank you.
Well, as there are no other questions, I will take my chance because I have a question about the internal teat sealants. When I was in practice, I had a lot of farmers that used them but had a bad experience, probably because their hygiene was not well. Do you have a tip to motivate those farmers to use them again? Because I see your results, and yeah, basically the outcome is that it's good that they are going to use the internal teat sealants again. Yeah, do you have a tip to motivate them?
Well, I mean, I would say that you would need to look at if the problems with mastitis accumulate into the beginning of the lactation. Then often they have already been the infections have been acquired from the dry period. So if that's the case, then I would definitely try to motivate them with that fact that it seems like the infections are coming from the dry period, and we need to be able to prevent them, and also the hygiene and the aseptic application procedure is extremely important in order to make it work.
Yes.
So if the hygiene on the farm is somewhat questionable, and a lot of the mastitis is environmental, you really need to get them motivated on the clean application procedure for the teat sealants.
Yeah, and if you have the feeling that this farmer is not, it's really difficult, to keep the hygiene in that kind of standards, would you then first say, well, do not use internal teat sealants?
If they are using internal teat sealants only them, so that that's the only way of prevention, and the hygiene is questionable, that would not maybe be the first thing that I would be recommending.
Okay, clear. Thank you. Are there others with questions? Otherwise, I have a last one, because Oh, Sinka, okay, you go first.
It's interesting. Do you have different recommendations for farms with Strep Achalaxiae or maybe Staph aureus, a different approach?
Well, especially with Strep Ac, which has become it's not common, but it has emerged in Finnish dairy herds again. So we do say that in these farms, especially if it's just newly emerged into the herd, that you could actually do the blanket treatment for about 1 year, so that you kind of make sure that every cow is treated once. But what we also try to tell them is that please not leave that habit of blanket trichal therapy as an ongoing method, because on the questionnaire, those farms that said that they used blanket trichal therapy, there was an opportunity to make comments there, and many of the farms that said that they were using blanket trichal therapy actually commented that they had gotten Strep Ag into the herd, and that's why they started using it. And then a couple of them also commented on the fact that, and we haven't dared to give it up. So they have kind of continued on that blanket treatment protocol as when they once started. So yeah, that is the kind of the if not recommendation, at least we say that it's okay for 1 year. And with Staph aureus, you really need to consider the cow as well, that, you know, with older chronic cows that have several quarters infected, probably the antibiotics are not going to do a whole lot of good.
Thank you.
Thank you. Then, yeah, it's also almost time. But I was amazed to hear that in one of your first slides, you mentioned that the Nordic countries always have followed the guidelines about, so they have never, yeah, they have never used like for all the cows antimicrobials with drying off. Is that correct, or you don't know, or because that's amazing? Yeah.
Yeah, I think that it is correct. Yeah. It is correct that it's if it's only been a small portion of herds that would have used blanket trichal therapy, if at all. Like in Finland, the 13% of the farms said that they were using blanket trichal therapy. So it's a very small proportion of all herds.
Yeah, so the majority of the farms in your country have never felt the urgency to use all the antimicrobials with drying off, like compared to other countries, which it was a routine to do it in this way. Yeah, that's
yeah, and like I said, I think that it's just what we have been taught. Like when I was in the US, I was totally and genuinely surprised when I heard that the antibiotics are given to all cows, and I was like, why in the world are you giving antibiotics to healthy cows? Why do you do that? I mean, I was genuinely surprised because I had never heard of it. It had never even occurred to me that you would give antibiotics to healthy cows, and it was just like, well, you have to. But yeah. Why? Because you have to, and but it's just what you have been taught and how you've been trained. And based on, like I showed the initial first trichal therapy trials, mentioned them, the cure rates and the prevention rates were so high, and the efficacy of trichal therapy was so good, and the prevalence of the infections were so high that at that point in the early 60s, late 50s, it made sense to say that just give the antibiotics to all cows. But the epidemiology of mastitis has changed over the decades, and now contagious mastitis has been conventionally what we call contagious mastitis. It's under control in many herds. And the environmental pathogens have taken over. So also not only is the concerns about antimicrobial resistance increased, but also the epidemiology of mastitis has changed. So I think that both of those give good basis for thinking more about the selective dry gut therapy.
Well, thank you so much. I really thank you for this good presentation. I have a last slide for all of you. So thank you for all the participants for being here. This webinar series, Voices of the Field, is organized by EU Jambrei 2, the Work Package 6.2, AMS in Animal Health, and IPC 7.2 in Animal Health. And we are coming back with a new Voices from the Field webinar, I think in fall. So we will update you about that later on. Thank you for your participation.
And thank you also from my behalf. Thank you for being here on a Friday afternoon.
Thank you. Bye.
Thank you so much. Bye-bye.
Bye.
Bye, thank you.
Bye.